So it tends to fall off. That's why we were missing it. So when you get angry, you put your hands on your hips and give attitude, right? Or the Z formation or whatever. But when, you know, when people get, you know, like that, this has got a great name. It sounds like the muscle from Starbucks. The tensor fascia latte. All right? And what it does is it tenses the IT band, tensor fascia latte. Okay? Fascia for the connective tissue sheath. Okay? And this, the IT band, the iliotibial tract, you can call it IT band. It reminds me of a soldier's uniform with a stripe going down the leg. Because you're looking at the lateral side, looking at the pinky. Okay, tensor fascia latte, and I always put it on the practical because it's everybody's favorite. It's a fun thing to say, you know, and it sounds like you're intelligent, but yeah, of course you're all intelligent. So let's work with the quadriceps. Quadriceps means there's 4 muscles. So, and there's 3 vastus muscles. So this is the vastus lateralis. Remember, it's on the lateral side. This is the vastus medialis. And underneath this muscle, which I'll tell you in a little second, is the vastus intermedius. Vastus lateralis, vastus medialis, vastus intermedius. The one that rides on top, it's a bipennate muscle, but they called it the wrong name. They called it rectus femoris, and it doesn't have a rectus fascicle arrangement. It looks more like, you know, salmon or fish, but oh well, what are you going to do? Just suck it up. This muscle here helps you cross your legs. It's the sartorius muscle. It's also called the tailor's muscle because tailors used to cross their legs and fix things. Sartorius muscle. I'm going to remove that so we can see other muscles. Okay, remember this is the iliopsoas, the iliacus, the psoas muscle. We're at the front of the leg. Now this muscle versus this muscle. This is the gluteus medius. This is the piriformis to do a pirouette. We're looking at the front of the leg, and there's a male organ, and there's bad words for the male organ. But if we can refer just briefly to the bad word of the male organ, to remember this muscle, this is the pectineus, near the pecker, right? So the pectineus, but students confuse the pectineus with the piriformis, so try not to, okay? So the pectineus near the pecker. And again, go ahead and, you know, sexual harassment, whatever. Okay, so remember the adductor, our horseback riding muscles are on the inside of our legs. There's 3 adductor muscles and 1 gracilis muscle. So you see next to the pectineus, there's this, and do a close-up. And usually I ask for this next muscle on figure because it's better viewed. But if I'm running out of muscles, sometimes I put it on leg C. I don't put it on the other legs. But this blue triangle represents the adductor brevis. And what's always next to a brevis is a longus. So this blue triangle represents the adductor brevis. This muscle represents the adductor longus. Then this muscle, and a lot of people want to say the adductor magnus, but it's not. This is the gracialis. Gracialis, it means it's thin. The gracialis, or gracilis. Gracilis. The next muscle going toward the back, this is the adductor magnus. So blue triangle, well, pectineus, blue triangle, adductor brevis, adductor longus, gracilis, and adductor magnus. And remember, this is the semitendinosus, and this is the semimembranosus. All right, so now we're going to go southbound. And again, when we go southbound, the muscles get smaller and they tend to have longer names, so it gets confusing. Does anyone remember what this bone is? What?
The tibia.
What's this bone?
Tibia.
It is a tibia. So what's really cool This is the tibialis anterior muscle on top of the tibia. Now, unlike when we're in anatomical position, our palms are facing forward, but the soles of our feet are down. So it gets a little confusing, trying to correlate palms with feet. But remember what angle the bones or the joints bend. So when we contract these muscles, what they're going to do is extend the toes. Where on the anterior of this, where we contract these muscles, what they're going to do is flex the fingers. But remember, the joint is a different side. It folds differently, okay? So the tibialis anterior. Next to it is the extensor digitorum longus. Extensor digitorum longus. And what's next to a longus?
Brevis.
Brevis. So that's the muscle that is not seen very well. Let me just double check. Well, you don't have to know the brevis. So this is the extensor digitorum longus. Now the other bone on the other side or the lateral side of the tibia is called the what? Fibula. So this is really cool. You can call it one of two different names. You can call it the peroneus, and most people don't remember peroneus, or you can call it the fibularis. And that makes more sense to me. Either one works. So here we go. This one is either the peroneus longus, or you can call it the fibularis longus. And next to the longus is the brevis. You can call this the peroneus brevis, or you can call it the fibularis brevis. Okay? Fibularis brevis. All right. Most people get this muscle right. This is the gastroc. It has a C in it. Gastrocnemius. Gastrocnemius. And just like the love handles, this muscle here is the soleus muscle, either on the medial or the lateral side, and we can actually expose more of the soleus underneath one of the heads of the gastrocnemius. You don't need to know the heads' names, but here's the soleus here, and it's also shown here. Okay, we're going to read, and this is Achilles tendon or calcaneal tendon. Either one works. Okay, so here we go. What was this region behind the knee called?
Popliteal.
Right, which is nice. This is the popliteus muscle. Right here is the popliteus muscle. Now, remember, this was the tibialis anterior. Right on the same side, on the tibial side, this is the tibialis posterior. That makes sense. This is where it gets a little hairy. You see the big toe, which is hallucis, correct? And you see the little smaller toes, and those are digits, right? Well, unfortunately, what would make anatomical sense is crisscross. So let me just go through this. If I'm flexing these muscles, they're going to help curl your toes or your big toe. This is the flexor digitorum longus, and you're like, what the heck? It's on the hallucis side. This is the flexor hallucis longus, and you're like, wait a minute, it's on the tootsie side, right? It's on the digit side. What happens is God really wanted to make sure you knew your anatomy, so he put the tendons, he crosses them under the sole of the foot. So that's why they crisscross. These make absolute sense, but these just gotta, kind of suck it up and remember. So flexor hallucis longus, flexor digitorum longus. Now the there's one muscle here, it's not shown, but it is shown like on this leg. Not very well. I just have to find it. Oh, extensor hallucis longus. So it's going to be on the front side of the leg. Extensor hallucis longus. Or extensor hallucis brevis. Wait a minute. No, extensor hallucis longus. Remember, oops, I'm missing parts. This is the tibia, so tibialis anterior, and this is the extensor digitorum longus. Extensor digitorum longus. Just over to it, remember this is longus. This is this little piece of muscle, which isn't very well represented here. They don't even show much of it. This little piece here, and again, I'm going to try and use this as a figure because it's not as well represented as I like. This is the extensor digitorum when you pull on brevis, so the longus and the brevis, okay? And those are all the leg and arm muscles you're responsible